We're going to begin with Steve Alquist of Uprise RI. He's actually relaying a question from Giovanna Rodriguez, a survivor and advocate. I heard that domestic violence is up 30% during last night's newscast. How important is it to get resources out to victims and let them know they're not alone?
Yeah. So thank you, Giovanna. It's vitally important. It's life-saving. I found out about this a few days ago when I was checking in with Colonel Manny of the State Police, and it's true, I think, across the state that the number of calls to 911 on account of domestic violence has gone up quite a bit in the past few weeks. Not entirely surprising. Many people are out of work. We're all stuck in our homes, and it's frustrating. Having said that, it's not acceptable, and we are putting together a comprehensive plan to address it. And that is comprehensive, looking for ways to provide more shelter, looking for ways to provide more a hotline and access and resources and information and outreach, certainly talking about it so people know they are not alone, and encouraging people to reach out for help if they need it, and also looking for additional ways that we can work with public safety to address it. It's a problem, it's a priority, and we're on it. And I would welcome your, as an advocate and as an expert, reach out to my office because we need your help, we want your ideas, and this is an everybody kind of a thing. We all have to respond.
Next question is from Alan Gabberty. The Elections Commission stated the discovery of 3 tubs of absentee ballots. A 2005 commission found these ballots are the largest source of likely voter fraud. To protect election integrity and voter confidence, will you work to reverse mail ballot legislation or require physical notarization?
No, I am not familiar with that, so I'm not going to talk about the hypothetical. Let me tell you what I think about this. I am a proponent of moving towards more voting from home, and certainly in this election it's something that we absolutely need to do, and the Secretary of State, Nellie Gorbea, is taking point on that. I think we need to have safe elections, obviously, and any fraud at all cannot be tolerated, but we also need to be in the business of removing barriers to vote, not making it easier for people to vote, including enabling people to vote from home.
Next question is from Brian Crandall of NBC 10. I'm not sure who would like to handle this. How far along are plans to completely isolate nursing home residents who are COVID positive and cluster them together? Are all aspects of care in nursing homes now separated between COVID positive and negative residents?
Thank you. So that is a normal process within our public health contact tracing and case investigation program. Prior to coronavirus and within coronavirus, whenever there is a cluster of cases, it is a critical component of the infection control response to be able to isolate the patients, whether it's within their own room, or the patients who are cohorted within a wing, or the patients who may be cohorted across a nursing home. So it's absolutely what we work on, in being able to separate them from people who may not have the particular illness. It's also critical to apply the infection control requirements that are needed for personal protective equipment, which is why it is critical to make sure that we are cohorting, bringing together the clusters of cases that occur. The care they receive is equivalent. It's also just making sure that the healthcare workers have the personal protective equipment that they need in place. We've also been working creatively with the nursing homes to think of additional ways to minimize how many different types of interactions or contacts with patients in nursing homes occur, so that we can decrease the risk of exposure across the board to COVID-19. Those are just a few of the many measures that we activate, and we're being as aggressive as we can in this time to help protect our nursing home residents. And I want to again acknowledge the staff who are there, who are committed and working so hard for the patients who are like family, the residents who are like family, the other staff members, to keep themselves safe. Also want to thank the associations and the nursing home leadership for the close partnership and doing everything we can to help protect the communities that are there.
Dr. Steph Machado of Channel 12 is asking, does the Rhode Island Department of Health agree with the new guidance the White House announced yesterday regarding critical workers going back to work if they've been exposed to the virus but have no symptoms?
So the guidance that we have is in every situation, if someone needs to be quarantined because they themselves have been exposed to someone who is a positive COVID-19 case, and they are a critical infrastructure worker, if that workforce environment can accommodate those people being quarantined and staying at home to monitor themselves for symptoms safely there, that's the #1 approach we want to take. In rare situations where in a group home, for example, the only people that may know the particular residents who are there is the small group of staff who are dedicated to them, and they are, if we quarantined everyone who was exposed, the home would not be able to care for the people there. Those are critical infrastructure workers. We are working very closely with situations like that when they occur, where someone can wear a mask, follow a long list of guidance recommendations that we have so that they stay safe, and monitor vigilantly themselves for symptoms. Temperature check, being able to assess, and making sure that they respond immediately if any evidence of symptoms or question of symptoms starts to develop. So what was shared is not an automatic, but it is a fallback if we need to, in order to maintain the workforce for these critical infrastructure workers, which is why that's the title of that working group.
Eli Sherman is questioning how many people are currently in quarantine and isolation, and is the state trying to get to a place where it can retest everyone who previously tested positive to try and loosen quarantine and isolation mandates?
So the number of people who we have in quarantine and isolation, I will get to. It's just under 2,000 or so. And in terms of loosening quarantine and isolation mandates, that is, quarantine and isolation is really the most aggressive and evidence-based approach we have to be able to be pinpointed, as the governor has described, in really preventing this virus from spreading from one person to the next person. So the opportunity to retest people is something that we certainly have as an option, but we really want to minimize loosening the core public health approach that works best to stop the transmission of this virus. We know that when people come together and they have symptoms, that is how the virus spreads. Being able to quarantine and isolate safely allows for doing that. So the testing will help support when there are times we can make targeted adjustments, but as a whole, we'll want to make sure we remain as aggressive as we can. The full number currently on quarantine is 2,243.
Richard Asnoff of Convergence RI is asking, are you considering mobile testing for residential homes in the behavioral health system?
As I mentioned earlier, we have a group of people focused on helping us address testing for our vulnerable populations. That includes those in the behavioral health systems, and particularly those in congregate settings, those who may not have transportation to be able to get out to the testing or need to be able to walk somewhere, as well as those who are homebound, and anyone that falls in those categories, or other categories similar to that. So we do have very active plans in place for addressing the needs of the population that Rich explained, as well as the other vulnerable populations that we have prioritized.
Sure.
Answer.
I want to clarify something around the testing and the mobile testing, just to make sure people understand where we are. The answer is we would love to be doing more testing. We would love to be doing more mobile testing. You know, in an ideal world, we could do mobile testing at every nursing home, every congregate care setting, behavioral health homes, et cetera. The reality is there is still a massive shortage of supply. In the past, I have referenced that we are in, quite truly, a global fight for resources, and that is true. I mean, for example, all morning this morning, we are arguing, pushing, cajoling to try to get more of the test kits for the machines that we have that are the rapid machine tests, which would be most well suited for exactly what you're asking about, these mobile testing units. We just can't get access to all the test kits and reagents that we need at any one time. We're going to get there. As I keep saying, we are definitely getting better. I don't want you to think we're not doing it because we don't want to or we don't think it's a good idea. No state, the entire federal government, we just don't have the supplies that we need at our disposal right now. The same goes for PPE. So unfortunately, we are making tough decisions every day about how to allocate resources.
Governor Tara Granahan of WPRO Radio asks, what can you tell home care companies whose employees are filing for unemployment insurance and asking to stay home to care for others, or they're concerned for their health, but the company has not laid them off yet?
So thank you for the question. You are not eligible for unemployment insurance if you have not been laid off. So if you decide to quit or leave or not show up, that is, of course, your decision. But you are not eligible for unemployment insurance. Unemployment insurance is for those who have been laid off. And as I've said many times, now unemployment insurance is available for those who've been laid off because of the coronavirus, because the state has closed down your salon or your barbershop or whatever. So those folks are eligible, but if you're just not willing to go to work, you're not eligible for UI. Furthermore, I would ask everyone, as I did in my prior comments, I know it's so hard to go to work. It's hugely challenging to go to work. You're afraid, and none of us really wants to be going to work. And if you're a home care worker or a CNA or caring for folks, it's doubly hard. I'm asking you, please, if you are well, to please go to work. And I'm asking companies to do everything that you can to make sure your employees are protected. Make sure if they're sick, they stay home and they're given sick leave to stay home. Make sure if they are going to work, they have masks or gloves, whatever is appropriate in the circumstances, full PPE depending on the circumstances. They have the opportunity to wash their hands constantly. They're given access to Purell or some kind of hand sanitizer. But if you're well and you're able and you're an essential worker, I'm asking you please to suit up and go to work.
The Boston Globe's Amanda Milkovich asks, what does the state's model show? When is the surge coming?
Yeah, thank you, Amanda. You know, I have been reluctant to share any particular model, and my reason for that is because it's still a work in progress, and I'm reluctant, frankly, to put numbers out there that I don't have a higher degree of confidence in, and causing panic on the basis of poor information. So we're still working on it. We still only have about 1,000 cases, and so every day we do more tests, we get more positives, we have better data, the model's getting better. Here's what I would say. We know it's sometime between late April and late May. That is our best estimate. Exactly the slope of the curve and how many hospitalizations we have, how many mortalities we have, it really is difficult to say right now because, perfect example, it was only 2 weeks ago that I put in place the stay-at-home order. We need at least 2 weeks of data, if not more, to see if that's effective. That's the biggest variable in determining the the timing of the surge and the magnitude of the surge. So it's unsatisfying for you to hear this, I realize. We just need some more time to get some more data, to look at our model, before I have any confidence in putting out there. And I know some of you disagree with me, but I'm making that decision because I don't want to cause unnecessary panic. And right now, I can tell you we're going up the curve. There's going to be a lot more people sick, a lot more people in the hospital, and our peak is sometime mid-April to mid-May-ish.
Governor, our last question today for this Thursday briefing is from Lynn Arditi. Nursing home workers say they are facing critical staffing shortages, with workers calling out sick or not coming to work and not being replaced. What are you doing to address these staffing shortages?
Yeah, we are communicating regularly with nursing home leadership because we recognize how critical this is. Some of the approaches of many that we are working on includes partnering with Rhode Island Response and the volunteers who are available. It includes accelerating the process for nursing students who are ready to get into the work field so that they can join in. We're working through the process to have that be expedited and have already begun reaching out to folks and getting them connected with the nursing home leadership. It also includes accelerating an opportunity for people to become certified nurse assistants and feeding assistants. And so making it so that a training that's available can be made known to people who have responded to volunteer, so that if they have the skill sets and the interest, that's also an opportunity. We recognize that people are also not working for other reasons. That's also a place that we can bring people in to be able to help address the staffing in the nursing homes. This is a critical piece. It's why I want to always acknowledge the staff who are dedicated and are in nursing homes. It's not easy, it's scary. That's just that baseline. But the commitment that is there for the staff who are there, we hear you, we appreciate you, and we're working to get more support to help because we know and understand what's going on.